All right, so this is my video assessment of the respiratory, cardiac, abdomen, thorax, spine, extremities, vascular, and neurologic assessment. So I'm going to start by scanning the room with the mirror. All right, and then we'll get started. Okay. All right. Hello, my name is Leela. I'm going to be your nurse practitioner today.
Hi, Leela.
Okay, so I have washed my hands and I have provided for patient privacy, and so we'll just begin. I'm going to start by asking you to tell me your name.
Hallie Friedman.
And your date of birth, please.
6/26/1997.
I'm going to ask you a few questions about your medical history. Have you had any past medical conditions?
I have narcolepsy and migraines.
Okay. Do you take any medications for those?
I take sumatriptan as needed for the migraines.
Okay. Any hospitalizations?
No.
Any surgeries? Okay. How about any current medical conditions?
Just those two.
Okay, perfect. All right, so we're going to get started. So I'm going to start with your mental status, okay? So where are we currently?
We're in New York City, New York.
Perfect. What year is it?
2025.
Who is the president?
Donald Trump.
What time is it approximately?
It's probably like 7:15.
Perfect. So that shows that you are alert-oriented to person, place, and time. And you are also calm and cooperative.
Oh, great.
And your speech is clear. All right, so now I'm going to ask you a couple of questions for cognitive function, judgment, and abstract reasoning.
Okay.
So, if you were to find a stamped and addressed envelope on the ground, what would you do?
I'd probably put it in a mailbox.
All right, so that means that your judgment is intact. How are an apple and an orange similar?
They're both fruits.
And how are they different?
They're different fruits. One is citrus, and one is not.
Okay, perfect.
And one's red and one's orange.
All right, great.
Okay.
So that shows that your abstract reasoning is also intact. So for now, for cognitive function, I'm going to actually come back to that because I don't have that prepared at the moment. But I'm going to just test your recent memories. I'm going to ask you to remember 3 words. I'm going to come back to it later in the exam. Apple, penny, and table. Okay, got them. So now we're going to start with the physical exam. Okay, so I'm going to start with your vital signs. I'm not going to actually do it for time's sake. But your blood pressure is 115 over 75. Heart rate's 85. And then what was your weight?
130.
Okay, so that means your BMI is 21.7, which falls within the normal range. Okay, I'm going to now examine your chest musculature. So if you could just open up the scan a little bit for me.
Okay. Is that okay?
Yes. Okay, so upon inspection, the chest is symmetrical bilaterally. There's no signs of trauma or lesions. The skin is dry, clean, and intact. There's no sign of retraction or use of accessory muscles to breathe. And you appear to be negative for respiratory distress. Okay? And you're also, I can see that your respirations are easy and clear. Okay? Okay, so now I'm going to examine the posterior chest. So I'm going to just stand in front of the camera so you can open the gown and turn it around so I can examine your back. Okay? Okay.
Okay, can you stand?
No.
Okay.
All right, so I'm going to have you turn to the side for me. All right. So the skeletal structure I can see is symmetrical bilaterally. I'm just going to move your hair a little, okay? I'm going to start palpation now, and just let me know if you have any discomfort, okay? Any discomfort here?
No.
Okay. I'm also going to, there was no tenderness and there was no crepitus felt there. I'm going to now check for chest expansion. So I'm going to have you breathe in deeply, in and out. And I'm going to I'm going to touch you at the same time and check to see if your chest rises and falls symmetrically and bilaterally, okay? All right, so go ahead, in and out. Okay, and do it again. Very good. I'm going to test for tactile fremitus. So I'm going to just move my hands down your back, and I'm going to have you repeat the words 99 each time, okay? So go ahead.
99, 99, 99, 99.
Okay, very good. So there was a slight vibration at the top of the top of the chest, bilaterally, and then further down the back, that vibration becomes less noticeable. Now I'm going to percuss the lung fields. Okay. So. And a resonant tone is heard with each percussion. Now I'm going to test for diaphragmatic excursion. So I'm going to have you inhale and hold again as I'm percussing, and I'm going to start now. Okay. Okay, exhale. And inhale again. Okay, and out. Okay, so when she's exhaling, the diaphragm is moving upwards, and that's just because air is coming up out of the lungs, okay? And I'm going to do that one more time because I forgot to do something, okay?
Okay.
So I'm going to start here at the top and have you inhaled. And exhale. Okay, so that's right about there. I'm just going to put a little mark on your back, okay?
Okay.
And then do it again for me. Okay, exhale. Okay, perfect. So the distance between those 2 points is about 5 centimeters, which is normal. And now I'm going to listen to her respirations. Just going to have you breathe normally, okay? Okay, the lungs sound clear. The region on the lower right-hand side indicates the sounds from the right middle lobe. The top middle up here are indicating bronchovesicular sounds, and then the remainder of the breath sounds are just vesicular sounds that are soft and low-pitched, and the inspiration is greater than expiration. Okay. Now I'm going to assess for egophony. So I'm going to ask you to say the letter E with each movement of my stethoscope. Okay.
Mm-hmm.
Okay, so the E sounds are muffled, which is normal. That's testing for consolidation, okay? Or negative for consolidation. Now I'm going to assess for bronchophony. So I'm going to ask you to say 99 again, okay? Every time I move my stethoscope.
99, 99, 99, 99.
So the 99 sounds quiet each time and muffled. It's not pronounced, which is would not indicate consolidation. Okay, you can move back to the front again. I'm going to just stand in front of the camera so you can change the gown to the front.
Okay.
So now I'm going to start with I'm going to move on to the anterior chest now. Okay, so I'm going to just inspect. If you could just open up the gown again a little bit for me. Perfect. So there are no obvious malformations, no lesions, and no trauma. Okay. The anterior chest is 1. And the transverse chest is 2, so there's a ratio of 1 to 2. The chest is symmetrical bilaterally, and I can see with each rise and fall that it's also equal. All right, so now I'm going to palpate again, okay? You just let me know if there's any discomfort, okay? Any discomfort?
No.
Okay. I'm going to palpate for chest expansion now, so I'm going to have you do the 99 again, okay? Every time I move my hand.
99, 99, 99, 99, 99.
Okay. So they were equal bilaterally. Okay. I'm going to now listen to your lung sounds on the front. Breathe in. Okay, so the lung sounds are clear bilaterally, negative for any bronchi or rales or cracking. The right middle side over here is where you have the right middle lobe, and the top middle the right middle lobe is over here. And then the right top is where there are bronchial sounds heard, and they are a little bit harsher, okay? So I'm gonna move on to the cardiac assessment now. So just looking at your chest, I don't see any evidence of lifts or thrills when examining the chest. I'm gonna palpate the chest now, okay? So this is, here is the second intercostal space, which is the aortic space. And then the third intercostal space, the left side of the second intercostal space is the pulmonic. And then the third intercostal space is Erb's point. Fourth intercostal space is the tricuspid area. And the fifth intercostal space is the mitral area, also known as the PMI, which is the point of maximum impulse. Okay, I'm going to listen, same thing with my stethoscope. Okay, I'm going to do this 2 times. I'm going to do it this side and that side, okay, the diaphragm and the bell. Okay, starting up here. Okay, so S1 is not as loud as S2. Okay, S1 is less than S2 here. S1 and S2 are the same at Erb's point. S1 is greater than S2. And S1 is greater than S2 in the mitral area. S2 is greater than S1 here. S2 is louder than S1 in the pulmonic area. S1 and S2 are the same. S1 is louder than S2 in the tricuspid, and S1 is louder than S2 in the mitral area. Okay, so now I'm going to have you just sit up and lean forward a little bit. Okay, and I'm going to listen to the diaphragm and the aortic area for the aortic murmur. And I don't hear a murmur, which is normal. Okay, I'm going to have you turn to your left side. This side. Okay. I'm going to listen to the mitral area for the mitral murmur. And listening with the both diaphragm and the bell, both are negative for any murmur in the mitral area. And there's also no presence of any extra heart sounds like S3 or S4. Okay. So now I'm going to move on to the abdomen. So I'm going to have you, let me just grab this little, you can turn back to the front. Okay, put your feet up for me. Sure. So I'm going to cover her up from the waist down. Oh, you're wearing shorts, I forgot.
Oh, yeah. My butt cheeks.
Thank you.
Sorry.
Can you pull your shorts down just a little bit for me?
Oh, sure, no problem. Thank you. Is that low?
Yes, that's good. Perfect, thank you very much. Okay. So, stand over here to your side, okay? Mm-hmm. Starting with the inspection of the skin. So, first, I already had you recline, I provided for patient privacy. I'm going to ask if you have any general abdominal discomfort.
No.
Okay. The abdomen is pink, and there is no discomfort, which is good. The skin is also intact, and there's negative for any scars or lesions. Okay, the umbilicus is inverted, and there is no dilated vascular pattern or ascites seen either. Okay, there's also no obvious bulging or any masses seen. Okay, I'm going to listen now. So I'm going to be starting in the right lower quadrant here, and I hear clicks and gurgles. I'm going to listen to all the other quadrants as well. And bowel sounds are heard in all 4 quadrants. I'm also going to listen for any vascular sounds just below the xiphoid process, which is here. And there were no aortic bruits heard with both diaphragm and bell. I'm also going to listen for the renal arteries as well on either side of the xiphoid process. and no bruise are heard bilaterally. Now I'm going to palpate the abdomen. So I'm going to palpate both sides of the aorta, okay? All right, there is a slight pulsation felt bilaterally, and the distance between my two fingers is about 2 centimeters, which is normal. And there's no evidence of a dilated aorta. I'm going to percuss now, okay? So I'm going to do this in different areas around the abdomen so I can hear different tones. Okay, so there's tympany is heard where there's air in the abdomen, and then there's a little bit of a dullness where there might be an organ or stool. Okay, I'm going to percuss the spleen now, which is in the left costal margin. And dullness is heard. I'm going to percuss with a gastric bubble now. That has more of a tympanic sound. I'm going to percuss now over the bladder. And there's a dull sound there. I'm going to percuss for the span of the liver now, starting here. Actually, we're going to do this side. And I'm just going to start here and percuss down, okay? And I'm going to mark where the dullness starts. Okay, so there's dullness until right around here at the side of the xiphoid process. And now I'm going to palpate your abdomen, okay? And just let me know if you feel any discomfort or pain. Okay, that was just a light palpation. I'm going to do a little bit of deeper palpation, but if you feel any discomfort, let me know, okay? Any pain?
No.
Pain?
No.
Pain?
No.
Pain?
No.
Okay. Now I'm going to palpate for your spleen. So I'm going to start on the left side, and then I'm going to just move more towards the left costal margin. Okay? And no enlargement of the spleen is felt. Okay? I'm going to palpate for your liver now. So I'm going to use this hook method, okay? Okay, I'm going to have you breathe in and hold me. Okay, and exhale. Again. And exhale. Okay. And there was no enlarged liver felt, and yeah. I'm going to palpate for your appendix now. So I'm going to be testing for rebound tenderness. So I'm going to just push down and then let go. And you let me know if you feel pain on either push or release, okay?
Mm-hmm. No.
Okay. Okay. Now I'm going to test for psoas sign, which I'm going to just actually expose your right thigh here. And I'm going to have you just lift your right leg for me, okay?
Mm-hmm.
Good. Okay, very good. Any pain there?
No.
Okay, so you're negative for psoas sign. Good. And then I'm going to test for overtrader sign now. So I'm going to have you bend your right knee, and then I'm going to, do you have any pain in your right lower quadrant here?
No.
Okay, very good. So that's also negative. Relax your knee. Okay, so I'm going to palpate the inguinal lymph nodes now. Okay, so for patient privacy, I'm going to do it over clothes, but usually you would do it just direct skin contact. And I'm going to be feeling both horizontally and vertically. And palpation shows no enlarged lymph nodes or discomfort. All right, so now I'm going to start with the vascular assessment. So I'm just looking at the lower extremities, and they don't show any signs of arterial insufficiency. And there's also no edema when pressing on your tibia. Okay, the skin is pink, warm, dry, and intact, and the temperature is the same bilaterally. Okay, now I'm going to be testing for Berger's test. So I'm going to have you just lift your leg for me and rotate your ankle. And this is allowing the blood to drain. You can go ahead and put that back down. I'm going to have you sit up. Okay, and I'm going to just move this out from underneath you, okay?
Okay, sure. I want to.
Okay. All right, so after conducting the Berger test, the patient puts her feet back down, and the color should return back to normal within about 10 seconds. And so that means that there's no signs of insufficiency in the lower extremities. Okay. So now I'm going to look at your arms. Pink, dry, warm, and intact. And I'm going to move on to your pulses now. Okay. So I'm going to start with the radial pulse. I'm just going to do this on one side versus bilaterally for time's sake. The radial pulse is 2+, and strong. Then I'm going to move on to the brachial pulse, which is also 2 plus. I'm going to come down here for the popliteal pulse, which is behind your knee. And it's a 1 plus bilaterally. I'm going to move on to the pedal pulses now, okay? So actually I'm going to have you put your feet up here. You could. Okay. All right, it's 2 plus bilaterally. And this is the posterior tibial pulse, which is also a +2. All right, I'm going to have you lift your legs, which they already are, and I'm just going to have you curl your toes towards your nose. Towards your nose.
Sound like that? Oh. Sorry.
Is there any discomfort there?
No.
Okay, so that's negative for Hohmann's sign.
Okay.
Okay, with no calf pain either. So when the patient stands, I'll also assess for any varicose veins as well. I'm going to do the Allen test now, so looking for blood flow in the wrists and hands. So if I can see your hands. I'm going to start with the radial pulse, and so I'm going to have you make a tight fist, and open your hand. I release push at the same time, so I can see that the skin color returned back to pink, which is a normal reaction. I'm going to do that again, and open your hand. And I'm doing that with both pulses bilaterally, and now I'm going to have you do it one more time. And I'm just going to release pressure on the ulnar side. Okay, release. And the pink color also returns, which is a normal reaction. I'm going to do your reflexes now. We're going to start. The reflex hammer is going to demonstrate contraction of the reflexes, okay? I'm going to start with the radial pulse again, so if I can see your arm one more time. And then the brachial. And that's looking for contraction of the bicep. And then I'm going to have you hang your arm like this. And I'm going to do it here. Okay, very good. All right, so I'm going to do the patellar reflex now. So I'm going to just move this out from under your legs. I'm going to have you just put your legs down, and I'm going to have you hold on to something so that you're not focusing on me.
Okay, sure.
Okay. Okay. And now I'm going to do the Achilles reflex. Okay, and that was a +2 reflex. I'm going to do the Babinski sign now, so I'm going to put this back under your legs one more time. Okay, just put your feet up a little bit like this. It's going to ticklish. Okay. So that was negative for the Babinski reflex. And then I'm going to assess for carpal tunnel now. So I'm going to have you hold your hands, the backs together for about, you would do this for 60 seconds, but for time's sake, we're not going to do that. And then release. Is there any pain or discomfort?
No.
Okay. And then I'm also going to assess the median nerve. So I'm going to just tap on the pulse rapidly. Do you feel any pain or discomfort?
No.
Okay. There you go. I'm going to move this out now. Okay. We're going to move on to the upper extremities for the musculoskeletal assessment. Okay. Put your hands in front of you like this. So looking at the hands, I don't see nodules or edema or redness. We're going to do a range of motion test now. So I'm going to have you form a tight fist with your hands, and then open and spread them wide, and then touch your thumb to each finger like this. So that shows that you have good range of motion. We're going to do the wrists now. So flex your wrist down and up, and in and out, and then rotate the wrists. Okay. I'm going to have you squeeze my fingers. All right, good. Grips are 5+ strength. And then also push against my hands. All right, and then pull. Strength of your hands is a +5. So now we're going to do the elbows, okay? I don't see any redness, swelling, or crepitus in the elbows. I'm going to have you flex and extend your elbows. So just flex and extend, very good. And then I'm going to apply pressure again. And so pull up and then down, very good. 5+ strength in each elbow as well, very good. I'm going to do the shoulders too. There's no redness or swelling in the shoulders, as I can see. I'm going to have you flex your arms, so raise your arms up above your head, and then extend down. Okay, and then hyperextend, so do, if you can, just, yeah, perfect. And then abduct, which means take your arms away from the body, and then adduct, move towards the body, very good. So I'm going to also just apply pressure again, so up and then down. Okay, very good. So that's a good range of motion and a +5 strength in each shoulder as well. All right, I'm going to have you put your feet up again. So, up here. Okay, so now we're going to do the, move over here. All right, so we're going to do the toes. So the toes are symmetrical, no nodules or bony growths, and their skin is intact, and there's no redness or swelling bilaterally. I'm going to have you flex your toes, and then bring them back together. Grip your toes like this, and then extend. Very good. Okay, I'm going to have you now close your eyes. I'm going to perform a test to see if you can tell where I'm touching, or where I'm moving your big toe, if it's up or down, okay? So close your eyes. Just tell me if it's up or down, okay?
Mm-hmm. Up, down.
Okay, very good. And I'm going to do that with your fingers as well.
Up, down.
So that means that you have good position sense, okay? I'm going to do the ankles now. So I'm going to have you flex up and down and out to the sides and back in and rotate. Very good. And then knees, no redness or swelling in the knees. I'm going to have you bend your knees and then extend. And then I'm just going to have you push and then push. Very good. So that's good strength in the knee. I'm going to do on the hips as well, okay? Do you have any pain in your hips at all? Okay, very good. So there's, I'm just going to lower this down a little bit and move this up. Okay, so there's no redness or swelling in the knees or in the hips. Can you just raise your legs straight up and down? Okay, and then abduct and adduct. Very good. Any pain or discomfort there? No. Here we go. And then just push against my hand. Very good. Okay, good. Sorry. All right, so now I'm gonna have you stand up. So I would wait 20 to 30 seconds to see if any varicose veins showed up once you stood up, because you're in the dependent position now. And I'm going to assess your spine, so if you could turn around. Okay, and then just stand like a little bit like right here for me. Perfect. Okay. So I'm going to just check your spine. Just let me know if you have any pain or discomfort, right? Okay. Me?
No.
Okay, the spine is midline. There are no signs of scoliosis, lordosis, or kyphosis. And then we're going to do range of motion, so if you could bend over as much as possible. Okay, the spine is midline. There's no curvature at the spine, and good range of motion. You can stand there. And then also you can face me now, and just bend to the right and to the left. Very good. And lastly, we're going to do a gait assessment. So I'm going to have you just walk a little bit. Take like 7 steps to the right. Okay, so the gait is steady, and your arms swing in opposition when you walk as well. Okay, I'm going to have you walk on your tiptoes now to check for balance. Okay, very good. And then on your heels. And then I'll have you do toe to heel, or heel to toe, sorry. And we call that tandem walking, and you were also steady there. Okay. We're going to do the Romberg test. So I'm just going to have you close your eyes and put your hands right here. And this is to test for balance, to see if she doesn't lose her balance while standing steady. And you can open your eyes. There's no abnormal movement or swaying. Now I'm going to do a sensory assessment. But before I do that, can you repeat those 3 words I told you earlier?
Apple, penny, table.
Okay. Okay, you can sit back down. I'm going to use a sharp object sharp object and a soft object. So this is going to be our sharp object, and this is going to be soft, okay? And I'm just going to touch different parts of your body. Let me know if it's sharp or soft, okay? Close your eyes. And where is it?
Forearm.
Side.
Soft.
And to the side.
My right shoulder.
Okay.
Left shoulder. Soft on left forearm.
Okay. No, keep your eyes closed.
Sharp. Right leg, lower leg.
Okay.
Sharp on left foot.
Okay, very good. Now I'm going to do this tuning fork test.
Okay.
All right, so I'm going to just strike it, and then I'm going to put it around different areas, and you just let me know what you feel, okay?
Okay. Vibration.
Okay.
Vibration. Yes.
Okay. All right, I'm going to have you close your eyes now, and I'm going to place an object in your hand, and this is called the sternocleidosis test. Okay. I'm going to place this in your hand, and let me know what it is.
Glasses.
Okay. Yes. And then I'm going to write something on your hand now.
Okay.
And tell me to identify, okay? What's yours?
An 8.
Very good. Okay, and that is the end of the test.
Thank you so much.
You're welcome. Thank you for being patient.
Mhm.